Good morning. Welcome to the TradNurse podcast. This is episode 6. Today's podcast will be discussing H1B visas and the nursing crisis and who's really being betrayed. I'm your host, Nurse Christine, an RN. I've been 25 years working as a nurse. I did have a guest, a healthcare policy analyst, a former hospital administrator, CEO, who was going to answer some questions for me regarding the H1B visa program, but he had a prior engagement. So I'm going to do this on my own. I did some research and being a nurse for 25 years, I have an opinion. So let's get into it. So I'm a defender of American first policies. And so with that, I defend American nursing, traditional values, and the truth at the bedside. I'm diving into a firestorm, and that's hospitals say they are desperate for nurses. American grads can't find jobs, and now Congress is talking about banning H1B visas. Even for healthcare, hospitals, they've talked about it for big tech, AI, but also hospitals. They hire a pretty large amount of foreign nurses through this program. So, is this a solution or a scapegoat? Stick with me because by the end of this episode, you'll know exactly who's being betrayed and what we can do about it. Let's start with the headline that everyone's heard. There's 250,000 nursing jobs unfilled. And that's from the American Association of Colleges of Nursing. I did a blog post on this today referencing all of this. Now, I've been at the bedside for over 2 decades. I've seen the chaos. I've worked in rural ERs with one nurse covering 12 patients, ICUs running on travelers, paid triple of what the staff nurses are making. So when someone says we need H1B nurses to survive, part of me gets it, but here's what they don't tell you. It takes 3 to 5 years to train an RN. And right now, nursing schools are turning away 91,000 qualified applicants every year. Not because they are not smart enough, because there aren't enough clinical sites or faculty to train them. And that is also cited by the American Association of Colleges of Nursing, the AACN. So this isn't a talent shortage. It's a system failure. Hospitals want a quick fix, import a nurse from overseas, pay them less, tie them to the job with a visa. Done. But that nurse had to pass the NCLEX. She's licensed, she's competent. So why are we treating her like a disposable patch instead of fixing the problem? And let's be real, most RNs don't even qualify for H1B. You do need a bachelor's and a specialty occupation. So, bedside nursing, usually an associate degree. In the United States, they're pushing for a Bachelor of Science degree in nursing. So, who's really coming in on the H1B visa program? Now, hold that thought because I'm going to tell you nurse practitioners and clinical specialists, high level roles are the bulk of foreign nurses. They're on an EB green card, but the public doesn't know that. They see H1B and just think replacement. Now, however, I remember when I was in nursing school in Miami, there were several foreign students in our BSN program on foreign visas, and one of them was a veterinary doctor in the Philippines. She came to the United States and her license wasn't transferable. However, she could get into nursing school. So it's very easy for these foreign students, if they have other degrees, especially in medical sciences or even veterinary science, to get into our nursing schools. So just keep that in mind. Now let's talk about the elephant in the break room. I've heard from new grad after new grad, they pass their boards, they have debt up to their eyeballs, and they're told there's no openings. Meanwhile, hospitals overseas are recruiting in like Manila, Mumbai. One nurse told me that she graduated at the top of her class. She applied to 47 jobs, got ghosted, then saw that same hospital post for international RNs welcome. So what is she to think? She chopped liver? It's just an observation. This is wage suppression 101. H1B workers can't easily switch jobs. They are indentured for years, so they take the overtime, they take the bad shifts, the lower pay, and guess what? That drags everyone's wages down. It's not about xenophobia, it's economics. And I see it here in Florida. I'm 25 years experience as an RN. I've done management. I'm willing to do bedside nursing. I must have applied for, I don't know, a bunch of different jobs. And it took a while to get called back. I did eventually take a workman's comp position just because I was tired of trying to get the hospitals to call me back. And also, the wages are so low coming from New England that it just doesn't even make sense. But that tells me it is not just that there's an influx of people coming to Florida. The H1B visa program, on every application that we apply for, we are asked if we will need a sponsor for that program. And that should be illegal in the United States. That shouldn't even be on our application. That's just my opinion. So, anyways, it is about economics. And also, it's not just about money, it is a safety issue. When you're burned out, overworked, and afraid to speak up because your visa's on the line, mistakes happen. And I saw a thread online last week. It's raw, ugly, but honest. One guy said, "I'm not letting an Indian touch me in a hospital." Is that wrong? Yes. Is it racist? Absolutely. But underneath that anger is a deeper cry. I've heard patients. My grandfather was in the hospital and he made a similar comment about a foreign doctor. So, why are we importing help instead of training our own here on the homeland? Thankfully, this debate just went nuclear. Yesterday, November 13th, 2025, Marjorie Taylor Greene, Congresswoman from Georgia, announced a bill to phase out the entire H1B program. This includes big tech, AI, healthcare, hospitals, all industries in America. She called it the mass replacement of American workers. But here's the twist. She carved out a 10-year exemption for doctors and nurses, up to 10,000 visas a year, and then zero. So it wouldn't hit hospitals hard, but is that fair? I don't know. But it is a political signal that we're serious about America first, and we're not going to be suicidal about it. We're going to be rational. And meanwhile, a month ago, President Trump pushed out a $100,000 fee per every H-1B visa. His logic: make it so expensive that only the truly elite talent gets in. The hospitals say, we can't afford that. We'll close the rural hospitals, rural clinics. So now we've got the Republican Party infighting, lawsuits coming from big tech, and nurses caught in the crossfire. And the real question no one's asking, why are we debating visas instead of building nursing schools? Let's stop arguing about symptoms and let's fix the disease. We're always told in nursing, bring me the solution. Here is the solution. And here's what we should be calling for: our American Nursing Renaissance Plan. 1, expand education. Fund 500 new clinical training sites. Pay nursing faculty like the PhD they are. They deserve it. Incentivize recruitment. $50,000 forgiveness for 5 years of service. 5 years. That's doable for the amount of money you pay travelers. Tax-free sign-on bonuses for rural and inner city hospitals. And also encourage retired nurses to come back with 4 or 6-hour shift incentives. I would do it. I'm not retired. I gave up in Florida looking for a nursing job just because of this situation. Another solution, and mandatory overtime. Nurses shouldn't be forced to work overtime. We're professionals. We have families. We have lives. And in nursing errors, the hospital will put the blame on the nurse. We should not be overworked, and it should never be mandatory. Zero tolerance for violence. Prosecute assaults like they're felonies. In Vermont, this started to happen. I've been a nurse 25 years. I've had hands around my neck trying to kill me. I've been punched. I've been spit at. It needs to stop. Lastly, bring back seniority and fair time off practices for employees. Retain the nurses. They should want to stay at your hospital and represent your brand. And here's the kicker. It's cheaper than importing labor. One study showed training 1,000 American RNs cost $10 million in sponsorship, legal, and relocation fees. And you own nothing long term. We are not anti-immigrant. We are pro-American. If a nurse from another country wants to come here legally, pass the boards, and serve, they are welcome, but not as a cheaper substitute, as a partner. We train our own, we pay them well, we keep them safe. That's not radical. That's responsibility. Before we wrap, I want to read 2 quick messages from nurses I'm communicating with. I am a Filipino RN on the EB3 program. I love America, but I understand when I hear American nurses frustrated and upset about foreign workers getting jobs. And we shouldn't be pitted against each other. She is also a friend of mine, and she is here legally now. She put in her dues, and she's an amazing nurse. Another, Jake, graduated in May of 2025 from an accredited American nursing school. 63 applications, 3 interviews. This was in Ohio. All said experience was required. Then he saw a job fair for international nurses only. And he was just, I'm done. I don't even know why I spent money going to nursing school. And it's just frustrating. New nurses should be encouraged to apply and be given a full 6-month to a year orientation, however long they need to feel comfortable. So those 2 nurses are not outliers. That is the system screaming, we hear you. This isn't about you. It is about a broken machine that treats human beings like widgets. So here's your mission. Call your representatives in Congress. Tell them support nursing education funding, not H1B visa programs. H1B visa programs are just band-aids. They do not solve the solution, and they do pit nurses against each other, and it's lowering our wages. And the nurses that they're bringing in, there's a communication barrier. They still are training. It takes 3 to 5 years to really train a nurse. So these new foreign nurses are already at a disadvantage. Share this episode, tag a politician, tag a hospital CEO. And also, if you are a hospital CEO or a nurse affected by the H1B visa program, please consider coming on this show and we can dive into this topic further. Thanks for a great show. Please like and subscribe. Let's make nursing great again by hiring American. Good old USA.